If you have been struggling with mood swings, irregular periods, constant down below dryness, fertility issues, breast leakage, even when you're not pregnant, neither are you breastfeeding, your prolactin level might be the culprit. In today's video, I'm going to be sharing two powerful vitamins that are going to help you bring back your prolactin levels to normal. And these vitamins have been backed by science. Many women experience high prolactin levels. Once your prolactin level exceeds 25 nanogram per ml and you are not pregnant, neither are you breastfeeding, it is considered to be high. And you will be struggling with getting pregnant with your menstrual cycle because elevated prolactin level can also suppress your ovulation, difficulty ovulating. And if you don't ovulate, indirectly, you will not have enough vital cervical mucus. This is why so many times you're dealing with this high prolactin level, you notice that you're always dry down below. But don't worry, today you're going to be getting your answers. All I ask of you is implement to the core. First, let us understand what is causing this high prolactin level. Why is my high prolactin level elevated? In this video, I'm equally going to be sharing some of the things that women ignore or they don't know that is causing this high prolactin level. Number one is certain medications. Number one of that medication is birth control pills. Yes, a lot of women are on birth control pills, especially when you are not married, when you are not trying to get pregnant. You just keep taking those pills because you want to prevent pregnancy or because it was prescribed for you because you want to correct some hormonal changes in your system. Secondly is when there is prolactinoma. That is a tumor growing in the pituitary gland because your prolactin is a hormone that is produced by the pituitary gland, which its function is to help your breast produce milk, assuming you're pregnant or you want to actually breastfeed after you're giving birth. All right. Next is when a woman is always stressed out. Yes, when you're always stressed out, it leads to messy hormones, and prolactin is equally involved. Next is when you are always on self-medication, not just about these birth control pills. Many women, they can be on self-medication because this person said this, because that person said that. They are always on self-medication. It can predispose your system to elevated prolactin levels. Next is when there is thyroid issues, either hypothyroidism, hyperthyroidism. It could affect your hormones. Prolactin is not left out. Finally is when you have excess estrogen in your body. This excess estrogen, you can get it from foods you eat, from what you eat from. If you're always fond of eating from plastics, nylon, you are going to be getting more estrogen mimicans in your system, and you overload the liver. Thereby, you will not be able to detoxify that liver. Many times you eat from all of these things. You have not made any intentional effort to actually do a fertility detox, a hormonal reset, or even to clean out your diet. You don't do that. So that's why you will take all those drugs, the carbamazepine, and still will not get results because you're not making any changes. Gone are the days when you just take one particular pill like that and it will fix all your hormonal issues. You need to understand that our hormones are talking to each other on a daily basis. When prolactin is messy, you can see that estrogen is linked to it, pituitary gland is linked to it, thyroid hormones are linked to it. So that is why it's going to be a collective effort. So let's get started. Number one vitamin you're going to be using. I don't care if you have been using so many vitamins. What you need to do what? Start with these ones. These vitamins work so well. There have been studies on it. In fact, let's check out the studies on these vitamins. So the first vitamin we're going to be checking out today is vitamin B6. This is also known as a pyridosine. It's actually a vitamin that helps with dopamine production. And this actually helps to lower elevated prolactin levels. So check out the study and how to use it effectively to get your desired result. A study showed that 300 milligrams of vitamin B6 taken in 3 separate doses daily reduce prolactin levels as compared to a similar effect you will get when you are taking carbamazepine. That's the justiness, okay? And vitamin B6 is also suggested as a treatment for hyperprolactinemia caused by certain medications. Good sources of vitamin B6 include poultry, your fish, your banana, your beans, okay? The poultry simply means chicken, turkey. What you will simply do is when you get the supplement, make sure you're equally indulging a lot in some of these foods, all right? So the next vitamin we're going to be looking at today is vitamin E. Yes, many women that are trying to get their period in order, boost their fertility, they're on vitamin E. But specifically, if your target is to lower elevated prolactin levels, take how you take this your vitamin E seriously. Check out the studies. Vitamin E is believed to naturally prevent rises in prolactin levels. Adding 300 milligram of vitamin E supplements to your diet may help reduce elevated prolactin levels. All right. So if you have concerns also, you can equally consult your healthcare professional or drop me a comment in the comment section and I will attend to it. Then let us look at things you must avoid if you're trying to really lower elevated prolactin levels. It baffles my mind that you are trying to work on the prolactin levels. Your breast is the one discharging that. Sometimes when you touch it, it discharges. Sometimes you don't touch it, it just discharges. Sometimes your partner was the one that noticed that yes, you were discharging and you have been taking some kind of medications. You are not seeing any results. First, if you want to start these vitamins, you must stop every form of stimulation. Stop stimulating the breast. It makes no sense. Because once you stimulate the breast, either by touching it, fumbling it, however, sucking it, you just give your brain the signal to let down milk production. And that's it, okay? So at this moment, at this junction, okay, everybody just have to do what? Have self-control around that area. Just stop stimulating it, okay? So that you give your brain the information back that yes, there is no more stimulation, tighten up the belt and stop this milk let down. Secondly is that you must stay away from processed foods. Enough of the indomie, the pastas, the bread and the tea, okay? All those ones, they are loaded with sugars that cause inflammations and these mess up your hormones. So stay away from processed foods, at least for 30 days. Give yourself that benefit of doubt to go with wholesome foods. Those foods that I mentioned that are rich in vitamin B6, eat more of them. And eat foods that are in their natural state more, okay? That way you are nourishing your body and see how the prolactin levels will start reducing drastically. Next is you must distress yourself, okay? So many times a woman is trying to get pregnant, to get her period regular. She's always stressed out, coupled with the work you will do in your office, in your home, friends, church, all of these things, they pile up in your system. So you must find a way to distress yourself. One of the ways that I personally use to distress myself is exercise. Yes, once I start to exercise, I get tuned more into the feel-good hormone and I get happy, I get to relax, okay? Exercise might not be the key for you. Find out what works for you in terms of really deeply relaxing yourself, okay? That way, you're reducing that excess cortisol and you're giving your prolactin a chance to really align itself. Finally, is that you must stay away from alcohol, smoking, any kind of hard medications. Stay away from them because they truly impact your liver. You know that with this high prolactin level, already there's excess estrogen. So you want to make sure you are not encumbering the liver with excess estrogen again. You want to make sure you're not encumbering and stressing out the liver with these lifestyle habits. So stay away from those alcohol, even if it's a sip. It really depends on how serious you are on really getting your hormones back, all right? If you have been taking other stuffs, like you have questions like, oh, should I still continue it if I'm taking my carbamazepine? Should I continue? I'm taking Vites. Should I? Yes, you can, okay? You can pair them up together and get your desired result. Preferably, those vitamins are to be taken on or with your meals. Right after your meals, you take them, not on an empty stomach. So if you're running on breakfast and dinner, or you're running on lunch and dinner, or you're just homemade 1 meal a day, okay, you can actually take it right after your meals. Get the recommended dosage exactly the way it's stated. Work with it for 30 days, depending on the level. So if we are looking at 30 nanogram per meal, work with it for 30 days. If it's up to 100, you might need to take it longer. But one thing is certain, keep on monitoring your progress, okay? As you take, it's really advisable you equally do a retest and see where you are, especially when you have taken for like 30 days, 60 days, 90 days, and see where you retake the test and see where you are, okay? And you'll be proud of yourself. You wish above all things that you and I prosper and be in good health. Even as I was so prosperous, I really appreciate you for tuning in. If you have questions, concerns, drop it in the comment section. NK Fertility Solutions is here to help.